What does dementia feel like as it gets worse? Dementia doesn't just affect memory, it takes away everyday abilities, one step at a time. When dementia kicks in, simple things like getting dressed, using a spoon, or recognizing loved ones can become impossible. But what exactly happens as dementia gets worse? And more importantly, what can you do to help? In this video, we'll break down the 8 signs dementia is getting worse, plus practical ways to make life easier for you or your loved one. Stick around to the end because these tips can truly make a difference. Let's get started. But take note, not all dementia patients will experience all these signs. The progression and symptoms of dementia vary widely based on factors like the type of dementia, overall health, age, genetics, and care received. Different types of dementia progress differently. With Alzheimer's disease, memory loss is the earliest and most prominent symptom. With vascular dementia, symptoms depend on which part of the brain is affected. Progression can be step-like. With Lewy body dementia, hallucinations and movement issues appear earlier. And with frontotemporal dementia, behavioral changes happen first, while memory loss appears later. It's not always the same. Some patients decline rapidly, while others remain stable for years. A person with early intervention and good care may experience fewer severe symptoms. Some may still recognize family members late into the disease, while others may never experience aggressive behavior or hallucinations. Conditions like heart disease, diabetes, or infections can worsen symptoms, but proper nutrition, exercise, and social engagement can slow cognitive decline. Now, here are the signs to watch out for and how to manage it. Number 1. Struggling with daily tasks. At first, it might be little things, forgetting how to use a microwave or mix up medication doses. But over time, it gets worse. They may forget how to dress properly or even how to use a toothbrush. Cooking becomes impossible. They might leave the stove on or forget they were even making a meal. Familiar objects, like a remote control or a phone, suddenly feel foreign. Why this happens? This is due to damage in the frontal and parietal lobes, the parts of the brain responsible for problem-solving, planning, and motor coordination. As these areas deteriorate, tasks that used to be automatic become confusing or impossible. How you can help? Break tasks into small step-by-step instructions, one thing at a time. Label objects around the house, like TV remote or toothbrush. Encourage independence where possible, but be ready to step in when needed. Number 2. Sleep problems and restlessness. Dementia can completely disrupt the sleep cycle. You might notice they sleep all day and stay awake all night. They start wandering at night, getting confused about where they are. Hallucinations or paranoia make it even harder to rest. Why this happens? Dementia disrupts the suprachiasmatic nucleus, which controls our internal body clock. This leads to sundowning, where confusion and agitation increase in the evening. Sleep disturbances are also linked to brain inflammation and reduced melatonin production. How to manage it? Create a calm evening routine and reduce daytime naps. Limit caffeine and sugar in the evening. Use soft lighting and calming music at night to create a peaceful environment. Number 3. Mobility and physical decline. Dementia doesn't just affect the brain, it weakens the body too. You may see weakened muscles and weight loss, increased falls or difficulty standing up, trouble swallowing, leading to choking risk, and fatigue and lack of energy. Why this happens? As dementia progresses, the brain struggles to control movement and basic body functions. Damage to the motor cortex, basal ganglia, and cerebellum causes poor coordination, muscle weakness, and difficulty walking. The brainstem, which controls swallowing and reflexes, also deteriorates, increasing the risk of choking and aspiration pneumonia, or food or liquid entering the lungs. How you can help? Encourage gentle movement like short walks or stretching to maintain mobility. Ensure proper nutrition. Offer soft, high-calorie foods to prevent weight loss. Monitor swallowing difficulties and consider thickened liquids if needed. Use grab bars, non-slip flooring, and mobility aids for safety. Number 4. severe disorientation and confusion. They may no longer recognize family or even themselves in a mirror. Other signs include confusing the past with the present, believing they are living in a different time, forgetting where they are or what year it is, complete unawareness of surroundings, making wandering dangerous. How to handle it. Avoid correcting them harshly. If they think it's 1975, go along with it if it keeps them calm. Keep familiar objects nearby. Photos, favorite blankets, familiar scents. Introduce yourself gently if they seem confused about who you are. Number 5. Complete loss of independence. At this stage, they can't manage daily life alone. You might notice they need help with eating, dressing, and even going to the bathroom. They forget how to use utensils and may need to be spoon-fed. Clothing choices become odd. Wearing multiple layers in summer. Why this happens? The prefrontal cortex, which controls decision-making and organization, continues to decline. The brain forgets automatic actions, like how to dress or chew. At later stages, muscle memory is lost, requiring total assistance. What you can do. Use adaptive clothing with Velcro instead of buttons. Offer foods that are easy to eat with fingers if utensils become frustrating. Keep a calm and patient attitude. Rushing them only increases stress. If you found this video helpful, give it a like, share it with someone who needs it, and be sure to subscribe to get updates whenever we upload a new video. Number 6. Loss of speech and communication. Words start slipping away. Over time, they may struggle to form sentences, eventually speaking only a few words or not at all. Not understand instructions or lose words' meaning. Use gestures or make unintelligible sounds instead of words. Why this happens? The left temporal lobe, responsible for speech production and comprehension, deteriorates. The brain loses the ability to find words, leading to silence or meaningless sounds. What you can do. Use simple sentences and speak slowly and calmly. Pay attention to facial expressions and gestures. Nonverbal cues are key. Use pictures, music, or familiar songs to spark recognition. Number 7. Severe personality and emotional changes. Dementia can bring drastic emotional shifts, like sudden aggression, paranoia, or extreme anxiety. A complete loss of emotion, no smiles, no reactions. Hallucinations, delusions, or believing they are in another reality. Why this happens? Dementia damages the amygdala and frontal lobes, which regulate emotions and impulse control. This leads to unpredictable mood swings, paranoia, or even violence. The brain also struggles to interpret reality versus imagination, leading to hallucinations. How to handle it. Stay calm and reassuring. Don't argue or try to reason. Play soothing music or give a gentle touch to comfort them. If aggression becomes severe, consult a doctor about medications or therapy. Number 8. Incontinence and complete loss of bladder or bowel control. Dementia doesn't just take memories. It also affects the body in ways that can be frustrating and uncomfortable. One of the more difficult changes is losing control over bladder and bowel function. Over time, your loved one may forget they need to use the bathroom until it's too late. Struggle to find or recognize the toilet. Need assistance with hygiene and changing clothes. Develop frequent urinary tract infections. Why this happens? The brain plays a key role in recognizing the urge to go and coordinating muscle movements to control it. But as dementia progresses, these signals become weaker or disappear completely. Memory loss, mobility challenges, and muscle weakening make it even harder to reach the bathroom in time. How you can help? Establish a routine. Encourage regular bathroom trips, even if they don't ask. Make the bathroom easy to find. Use clear signage or keep the door open. Simplify clothing. Elastic waistbands are easier than buttons or zippers. Be prepared. Keep extra supplies like wipes, adult briefs, and bed protectors on hand. Remember, each dementia patient has a unique journey. Some decline faster, some retain certain abilities longer, and not everyone experiences the most extreme symptoms.